He's a crazy pants, but he's a sweetheart, a good kid.
No, I am not a sweetheart.
You're not? Are you a crazy pants, though?
Yes, I am a crazy pants.
There you go. We noticed that his arms were kind of sore when we would play with him. We asked him if he was hungry. He said no. We brought him into our family physician, and he thought he had the mumps. He had a fever.
So they did blood work. Just as we were going to bed that night, a pediatrician called and said, you have to take Sully to Children's. They're expecting him. The pathologist has confirmed he has leukemia.
Sully has pre-B cell acute lymphoblastic leukemia. It's the most common type of leukemia in children. We treat acute lymphoblastic leukemia with chemotherapy. For boys, it's about 3.5 years, with the first 6 to 9 months being very intense, and then the last 2.5 years with something called maintenance chemotherapy.
We just started maintenance today, which we've been doing frontline treatment for 9 months. We've been inpatient for probably close to 30+ days. But Sully is considered high risk because of CNS, which is disease in the spinal fluid at time of diagnosis.
Thanks to great research and clinical trials, we've come so far in the treatment of pediatric cancers, especially leukemia. 40 or 50 years ago, this would have essentially been fatal. We rely on funding to move this research forward and be able to bring it to our patients. The National Cancer Institute only budgets about 4% for pediatric cancer, and 14,000 children are diagnosed with cancer in the United States each year.
My boy got no choice. He just got sick, and there was nothing anybody could do about it.
When I had him, I wanted to protect him, and I feel like I let him down because when you're standing over the edge, looking at something that could take away your son, it's pretty scary. But, you know, he's doing great, and day after day, we just have to remind ourselves, base it on how he's feeling. And as you could tell today, he's doing amazing.
My hope's that in 20 years, if we were having the same conversation, that we wouldn't be having it. We won't stop until everybody has a prognosis of 100%.
Hopefully that him going through this, if this means one step closer to not even a cure, but just a shorter treatment time. If we can get down to a year,